See, I would say that any person who is above 15 years of age and who is less than 50 years of age can undergo a mobility analysis, especially if they had a knee pain, a back pain, neck pain, shoulder pain, or they are interested in adding some exercise into their lifestyle. So those children, the young ones who want to join and take up some sports, it is very important to know where they are starting from. What is their baseline level? As an example, I will tell you one thing, is that there is a lot of concussion or head injury chances when someone plays a football at a high level. We never try to find out what their capabilities were after they get an injury. If we know that this was the person's brain function level before the injury, then it is very easy to understand the problems that are very minor in nature, which may otherwise get missed if you have not done a baseline analysis. So in any child who wants to take sports seriously, it is important to know where they stand and what their problems are and what are the various physical mistakes. For example, having a calf tightness, having a hamstring tightness, having an asymmetry in strength between right and left side, these are all can be easily overlooked in children. And if these are overlooked and if they end up being a very promising athlete, at the peak of career, these things can sometimes stop their career growth itself. So if they know that these are the deficits, coach knows about it, the physiotherapist knows about it, they can do the corrective. So it's very, very essential for all those who are aspiring to be sports people to have their mobility analysis done and do their correctives by themselves, empowering the sports person themselves. The same principle holds true for any person who wants to start exercises first time in life. We see commonly that lots of engineers at 25 and 30 take over going to gym at that age for the first time. These people all, they just go into the hands of a trainer who would give them a general or a standard therapy which is given to everyone. And many of the people get some kind of injuries and many of them stop their careers. So every person who is aspiring to go to should undergo an analysis, know what their mistakes are and to always do the correctives. This issue is common in India is because we have often seen that people end up going into a gym or gym related activities, get an injury and then come back. Injury prevention is as much important as exercises itself. Any exercises can lead to injuries and we need to avoid getting these injuries by understanding our mobility capacity, and exercises have to be individualized and customized to how the body is, what the body composition is, what the body tightness is, and so that any person who goes into an exercise is aware about injuries and tries to avoid or getting into problems. So in summary, mobility analysis is for anyone who aspires to go and join a gym for the first time, those who are ready to want to go into sports, have a baseline analysis, and for any person who has got a knee pain, shoulder pain, back pain, and they don't want it to come again and again in their life.